Good afternoon. Welcome to Schein Chats. I'm Jen McGuire. I'm responsible for Henry Schein's Total Health program. And with me here today, I have Dr. Susan Maples, founder of Total Health University, board member of the American Academy for Oral Systemic Health, and a practicing dentist. Thanks for joining us today, Dr. Maples.
Absolutely.
One of our mutual passions is how to address the growing healthcare crisis in this country through dentistry. And dentists and dental teams can play an important role. So before we get to that, I wanted to talk a little bit about the epidemic of obesity and diabetes in the country.
So it's scary to me because I think if you look at the CDC statistics, you'll know that we're not in a healthcare crisis yet. It's coming in a huge measure. They've now said that we're now about 30 to 35% obese as a nation. We're aiming to 42% obesity by 2050, hoping to top off at 42%. And the lifestyle-related illnesses that go with that are crazy. The fact that we're now spending twice as much as any other country per person on healthcare, and we're 17th out of 17 in industrialized countries for health, means that we're getting an F in health class.
So our dollars are not effective.
No, absolutely not, nor is awareness. We actually made the obesity crisis a big awareness campaign on the cover of Newsweek magazine and everything about the year 2000, and since that time, the situation has tripled.
So how does that, do you see that reflected in your practice, in your
Absolutely.
patients?
Unbelievable, because I've been there over 32 years, and it's wild to see that. And the lifestyle-related illnesses that go with that. Heart disease being number one, of course diabetes being number, cancer being number two, diabetes, depression, hypertension, all of that. And with our new fabric of healthcare, is more like sick care, so you basically go to the doctor and spend an average of 7 minutes and get a pill for a pill. So now we see all the medications loaded on that most of us don't associate with health, right?
And I think that's something that we like to talk a lot about at Henry Schein is the role of the hygienist. Because patients only have 7 minutes with their physician, you have so much, the hygienist has so much more time to do education about health. And is that something that your hygienist does in your practice?
Absolutely. It's interesting because we have this built-in preventive relationship that isn't based on any scientific evidence, this 6-month relationship. And we're kind of losing ground on what we're trying to prevent, which is caries, periodontal disease, occlusal disease, and oral cancer. But we have a huge opportunity to try to predict and preempt major disease if we could talk about this. An interesting study of University of North Carolina, I think it was November 2010, a big study that showed that dentists across the nation, 50% of them who answered this very large survey said they want to participate in the obesity crisis and talk to people, but only 1.6% were doing anything related to diet or nutrition counseling. They said because they didn't want to look like hypocrites, they didn't have tools, they didn't feel like maybe they were adequate to talk about it, or they didn't have referral sources. There were a lot of reasons why. So we're trying to, in our practice, set examples for the rest of the country, as well as using Total Health University and the Blabbermouth book to kind of help dental teams know how do we approach those situations. Everybody wants to lose weight. If you just ask on the health history, are you interested in changing your weight? They'll say, a lot of them, yes. And so then we say, tell me your journey. We start by just asking a question. That opens up a big avenue and building tools for how to help us.
So you really let the patient drive the conversation rather than having it come from you, and have you considered losing weight? You're letting them tell you that's something they're interested in.
We are responsible for weighing a patient, so we don't have to diagnose obesity or even give them a BMI. But we do need to help them get the health that they're looking for. That's part of our role, to hold the container, to help them show up every time in their office taking one step forward toward their own health. That's part of, I think, our coming responsibility.
Yes, but losing weight is one of the most difficult things that people face. I mean, people try a lot of different tactics. But you've had tremendous success in helping your patients to lose weight. What do you think is different about your approach that patients find such success with your system?
Well, I'm going to be really frank and tell you that I think that who's making money on this obesity crisis? The food industry, the pharmaceutical industry, the beverage industry, all making a lot of money on the backs of our illness. It's very difficult for adults to eat well in our, in our
the convenience food,
exactly.
And people are busy.
So what we do is really ask them to take a good look at what they're eating, and part of it is to tell us what you're doing now, what calories. And I'll tell you the biggest piece of this is sugar. We picked fat originally back in the 50s when Eisenhower had a heart attack and heart disease was the big buzz, and the no-fat craze was the single biggest contributor to obesity in the history of the human race. The too happy to replace fat with sugar because they knew already that it altered our ability to satiate ourselves. In other words, we're now consuming about 240 calories a day more than we did 20 years ago just because of an increase in sugar. And sugar's always been our name. So part of it is helping them see where they could look at not, I don't believe a calorie is a calorie is a calorie. How do we decrease sugar and processed food, simple carbs, and replace it with high fiber foods, carbs in their original form, with the fiber in it. A more high fiber diet, and one that's more nutritious and brings with them. So we do this. We had an Eat Clean challenge in 2015. Eat Clean for 15 days and 15. So Eat Clean for 15 and 15, and we had most of our patients, we did it for a whole year, signed a commitment card, we lined our hallways full of them, and for 15 days, they had to eat nothing but foods that had 5 ingredients or less, and they had to be real food. So they took a vacation from what they were eating.
Processed
foods.
foods.
Look at that one step was a big one. We also use other tools and charts and food apps like Food Educator to help people understand what they're eating.
So you help your patients create accountability too in their lives.
Yep.
And who takes the lead in your practice around your health effort? I mean, who leads the charge?
Oh gosh, I think we all do really. The hygienists are in this unique preventive relationship because they have these ongoing relationships where if we can stop talking about our vacation, start talking about our health, and we're all in it together.
Use that time productively.
So they really do spend a lot of time talking to the patient about here's where we were last time, what's happened since then. Try to stay away from judgment, either positive or negative. We don't jump up and down when they've had huge successes. We say, like you would say to your child, I'm happy for you, Logan, right?
Yes.
I'm happy for you, not I'm so proud of you. Tell me how you did it. Tell me about your story. We get them to talk about what's working and also where their challenges are. And that's where we can kind of tweak and help them. We don't have to solve it overnight. We just have to help them figure out where they're falling down and what they can do. And start by getting rid of all liquid sugars. That's a big deal, right?
So simple steps for your patients to take that they can find quick success with. And along with the obesity, of course, we talked about diabetes. It's the next step. So you did an interesting study in your practice to check
diabetes is unbelievable. We have 105 million pre-diabetics and diabetics in our country. We have 77 million pre-diabetics who don't even know it. And those are people we can help them turn the ship around. If I could tell you were pre-diabetic and sort of predict how many years it would take you to be a type 2 diabetic, would that wake you up?
Yeah.
Yes.
I'd be willing to make some changes.
Right. Plus it's bidirectional. It has an effect on periodontal disease.
Right.
So we want to preempt that as well. But we did a study where we tested 500 of our patients, A1C, to take a look at only unknown diabetics, nobody with any history, not even history of pregnancy. And we found out that 19.2% of our patients were either diabetic or pre-diabetic and didn't know it. That was probably, I said that before, the Eat Clean Challenge was the biggest. Actually, I think those 19% really got serious about what they were eating, how to lose weight. I mean, that was a big wake-up call.
That's, especially since I would imagine you attract a healthier patient on average to your practice. Still a huge number.
Yeah.
How do you help them communicate with their physician? So they got this information from you, their dentist. How do you arm them?
I'm so glad you asked that because we write the letters for them. And I ask permission to reach out to the physician to let them know what we've talked about and where we are with this and what are the signs and symptoms that we've seen of preempting other diseases. And the reason we do that, we want the medical community to know about our practice and what we're doing. We want those referrals. And so now, of course, our practice gets lots of referrals and lots of patients who are healthcare workers themselves because they know our commitment to smoking cessation and food sensitivities and diabetes and obesity and all of that.
So it all flows from your efforts around patient care, and they see that reflected and send patients your way.
We want to make sure that patients know that every 6 months this visit counts. Even if the insurance company stops paying for those 6-month visits, we want them to know there's one place in my life that holds the container for my health, that's willing to reach out and advocate for me to my other healthcare teams, that wants to help me get off medication and live a longer, healthier, more robust life.
And your point about the insurance paying for 2 visits per year, I mean, you mentioned there's no scientific basis for that, and it should really be.
Thinks that we're doing them a real good service, but the fact is, it came from a commercial from Pepsi, an advertisement in newspapers in 1940 that said brush your teeth twice a day with Pepsodent and see your dentist twice a year.
So we can assume that when more research is done, they'll probably find that really patient care should be customized to the needs of the patient.
Absolutely.
But that will affect insurance coverage and eventually maybe even a move to outcomes-based reimbursement rather than procedures-based.
One of the things that I think people are going to ask if they're watching this is, where do I get the time to do that? And I can tell you, one of the ways you find the time to stop polishing teeth. There's no efficacy in polishing teeth.
So
we only polish for stain and stain alone. And the fluoride varnish actually acts better on teeth that have the biofilm there. So that news is news for a lot of people. It's like, take a few minutes, and before you get started, before you're sitting the patient back eyeball to eyeball, with a real sincere heart for a care for them, ask how they're doing, how healthy are they, how's their energy. I know that you've been looking at trying to trim down, and I know you'd set some exercise goals. How's that going? So sort of just to get on the same page.
So your appointments aren't any longer because of the time that you're taking to let them know you're interested in their health and you can help them. Right. You're moving towards things that are more effective.
Right. But instead of doing things that are just routinized, we try to customize the visit for the patient. If they're, for instance, a smoker or a chewer, we always pick up the Identify. We always do a complimentary oral cancer screening. That's not something we would necessarily do for someone that didn't have those risk factors.
Right.
We might do an A1C test for someone that had the risk factor for diabetes. We might talk about setting them up with a home sleep study for someone that we looked at and we could see airway issues. You know what I mean? So we use that time differently for every person.
And your patients don't object to, they're paying out of pocket for a lot of these things, but they're happy to know.
Very fortunate. Yes. We have a fee-for-service practice that is not non-participating in we don't participate in any insurance plans. In a very unlikely area, a very small town adjacent to Lansing, Michigan, which is kind of the home of the economic crisis. Yeah.
So any other thoughts on where you see the role of dentistry going in healthcare overall?
Well, I think it is our privilege and our responsibility, both to build a better life for Logan and for your son and for his kids, because really, we cannot afford this. Let me give you one quick statistic. We spent $245 billion on only 16 million diabetics in 2012. We're expecting 103 million diabetics, 16 million to 103 million by 2050. So we can't afford even one disease. We're never going to put a big umbrella on this healthcare crisis because it's creeping up and getting bigger. And as it gets bigger and people get sicker, less tax dollars. You see how this works? We have to participate. And it's such a privilege to do it. And it increases our case acceptance, and it draws more health-minded people in. And people who value health will spend their own money on health.
It's so
Perfect fit.
If only we could get more people interested and engaged. So.
That's right. Well, I love the fact that we've created Total Health University.
So we have resources.
It's an online platform for dentists to be able to jump into a total health practice and implement it together as a team. The best benefit of doing this as a team is all your team members get healthier. And guess who they credit for that? They may not get all the raises they want in the world. We're never going to be able to pay them like we pay an auto executive, but we certainly can enhance their lives and their families' lives by participating in their own health journey.
Build your practice as well. That's great. Thank you so much for joining us, Dr. Maples. I appreciate it. Thank you, everyone.